Hi, Janai.
Hi.
Hi, nice to meet you.
Nice to meet you.
Okay, come on in.
Thank you.
Okay, so,
I just have to get my resume.
oh, perfect.
Here you are.
Thank you. We're early, so that's good.
Yes, ma'am.
We're on time. Okay, thank you. So I'm just gonna go into the questions
Okay.
For you today for the interview. So I just want you to tell me a little bit about yourself right now.
Well, I'm originally from Waterbury, Connecticut, and then I decided that I wanted to pursue my dream of becoming a registered nurse, but I wanted it specifically from Howard University.
Okay.
So I came down here and I graduated from Howard University in 2017.
Oh, wow. Congratulations.
Yes, thank you so much.
Mhm.
And then I went back home and I went to study more at Yale, and I got a job there also in the pediatric field.
Okay, that's great. So can you tell me a little bit just about your strengths?
I would say that I have plenty of strengths. My ones that I think should be showcased would definitely be my versatility,
Okay.
definitely a big one, and then my dedication to my field, my work I do every day. I just definitely dedicate it.
Okay, and then can you tell me a little bit just about your weaknesses? too?
I would say, if I was to tell you one of my weaknesses, I would say I'm too critical of myself.
Okay.
Yes, and I definitely think that another weakness would be that I try to please others
Okay.
before myself.
And are you working on that?
Definitely, I'm definitely working on that. I think that me being too critical, I'm starting to commend myself on things I do well.
Okay.
And then the other one, I'm definitely making sure that I know that it's okay to say no if I can't do it.
Okay. And then, so you're applying for the position for pediatrics.
Yes, ma'am.
And why do you feel that you're the best candidate for this position?
Well, I would think that I'm the best candidate because, as I previously stated, that I worked at Yale Hospital and I was in the pediatric field, and I just have a grave interest in the development of children and their safety and their health, ultimately.
Okay. And then, how would you deal with someone who isn't pleased with your patient care? So.
Well, sickness is a hard thing. You know, people who are sick, they become overwhelmed and they have a manifestation of frustration and anger towards people that are caring for them. So I definitely every day, like I said, I'm dedicated. I strive to make sure that I give the best patient care that I can. For instance, one time a patient went to my supervisor and told them that I wasn't following the right steps and orders, but when it brought to my attention, I assessed the situation and I just thought that it was probably a miscommunication. I told them how I followed the doctor's orders to a T, and then when we went to go talk to her, she just said that it was a miscommunication and that she apologized to me, and I also apologized to her because I know it can be a struggle going through sickness and having someone random just come in, try to take care of you, and you feel like everything's falling down.
Mm-hmm. Okay, and then how would you handle stress on the job?
I think on the job, I'm very organized. Organization is a really big thing for me.
Mm-hmm.
So I plan out everything that I'm going to do, especially like when I come into work and come in early, make sure that I get everything I'm supposed to be doing for that day. And then I also, when I'm planning, I make sure that I put in some space. Therefore, if something out of control happens, that's out of my control in particular, that I'm not overworked and overwhelmed that's happening because I planned for it.
Okay. And then are you comfortable working with others?
Yes, definitely. All of my jobs, even from when I was younger, had something to do with colleagues, and coming to Howard was a really big thing for me because it's such a big sisterhood, brotherhood, everything all around me. So I think that working in a hospital is no different.
Okay, and then have you previously had any leadership positions or any positions that were higher in the past?
Yes, absolutely. I was a head nurse on the pediatric unit, and then I actually went in to become a supervisor for that unit also.
Okay. No. Okay, and do you have any questions for me?
Yes, actually I have 2 questions for you. So my first question is going to be about how long do you think orientation will take?
Our orientation actually lasts about, I want to say 4 weeks to maybe like a month, month and a half. It's usually a pretty quick process, so.
Okay, great. And then my second question is, what are you looking for? What characteristics or attributes do you expect your applicants or candidates to have when applying for this position?
Usually we look for someone who's empathetic, someone who can connect with the patients and, shows that they have a good relationship with patients, someone who can work well with others, such as, coworkers, and usually someone who's hardworking and just is dedicated to what they're doing.
Okay, great.
Okay, well, that's all I have. So it's nice.
Thank you
meeting
so much
Thank
for this
you.
opportunity.
Of course.
You have a great rest of your day.
Okay, and we'll give you a call just to follow up with you.
Okay, thank you.
Thank you.